I can confirm the webcast has started. Thank you, Councillor Fairhurst.
Thank you. And if we go to the agenda, we have no deputations. And we are looking at Hampshire Disabilities Day Opportunities model. Jason, you're taking us through this?
I am here, yes, Councillor Fairhurst. Yeah, I'll take your guide really on how you want to address this. Would you like me to walk through the paper, or how would you like to proceed?
For the benefit, if anyone is watching, I think you should walk through the paper a little bit. Yeah.
Absolutely, yeah. Okay, so I'll make a start. Does everyone have the paper available?
Yeah.
Yes. So the purpose of this report is to seek permission from the Executive Member for Adult Social Care and Health to continue spend on day opportunity services for people with a disability or a mental health issue through use of our Hampshire Disabilities Day Opportunities model for a further 4 years. And the recommendation is that the Executive Member for Adult Social Care and Health gives approval to spend up to a maximum value of £25 million through the 4-year extension to the HDOM, the Hampshire Disabilities Day Opportunities model. And this would be from the 1st of December 2020 to the 30th of November 2024. In terms of the executive summary, the Hampshire Disabilities Day Opportunities model originally commenced from the 1st of December 2016 for an initial lifespan of 4 years, which may be extended at the Council's discretion by up to an additional 8 years in 4-year segments. And the maximum lifetime spend of the model is £70 million. This report seeks approval to continue to commission relevant services for people with disability through HDOM. This includes services for people with learning disabilities, physical disabilities, and mental health issues. And just to clarify, these are adults under the age of 65. This is not relevant for older adult services. HDOM provides benefits to service users and the County Council by providing a service specification and quality standards for externally contracted day opportunity providers. The County Council also benefits from the transparent pricing information that providers share as a requirement of their HDOM membership. In terms of contextual information, a very diverse range of activity is described under the term day opportunities. This includes providers delivering traditional daycare centres, vocational training services, community-based services, and specialist services. The provision of daytime activity fulfills a key respite function for many family carers who are dependent on this provision in order to work and to fulfil their caring role. Services tend to have fairly low levels of throughput, with some individuals attending the same services for many years. The County Council currently contracts with 80 external providers, providing services to approximately 700 people, and this spend on these services is around £5.4 million per annum. The day opportunity markets are the people we contract with externally are primarily small and medium-sized enterprises, many of which are third sector organisations. And day services continues to offer good value for money, particularly compared to one-to-one support. It's quite a cost-effective way for us to meet people's needs. Day opportunities are not currently regulated by the Care Quality Commission in England. This means that some activities that would normally be regulated in other care environments, such as personal care, are carried out with little or no external oversight or registration requirements. Providers that are contracted through HDOM are required to meet a minimum quality threshold, which is transparent and open to scrutiny. This provides a level of assurance to the County Council as a commissioning authority in the absence of the external CQC regulation. HDOM has allowed the County Council to articulate its requirements through a service specification for outcomes-focused services, enablement and skill enhancement. The HDOM specification also presents the Council's vision for enhanced community inclusion and the potential for volunteering and paid employment opportunities for people with disabilities. Further developmental work is planned with our HDOM providers to ensure that we have this effective care pathway and to encourage greater throughput. In terms of finance, the current annual spend is £5.4 million per annum, as previously stated, and that's across learning disabilities, physical disabilities and mental health budgets. This does not include mental health wellbeing centres or some other service models which sit outside the scope of this report. The £5.4 million annual spend is fully budgeted on a recurring basis. It is anticipated that overall spend on the provision of buildings-based day services will decrease over time as those services become more focused on those with the highest level of needs. However, the maximum provision has been requested. Correspondingly, service users who attend these services will continue to have their care and support needs reviewed, at least on an annual basis. Any reduction in spend from these contracted services will be invested in alternative care provision, with the potential for further reductions in costs to contribute towards the Council's transformation to 2021 savings programme. In terms of performance, services provided to individual service users are monitored through Care Act assessments through our community social work teams, and it's a minimum requirement that providers develop and implement their own sort of robust quality assurance and outcome monitoring systems, which can be shared with commissioners both at the social work level and at a contractual level. During the 1920 financial year, Adults Health and Care undertook an audit of 20 of our largest HDOM providers. This audit measured how providers were performing against the service specification and the key quality standards therein. The process will continue to roll out across all HDOM providers with a view to developing opportunities for peer audits, so providers can work across themselves to ensure they're meeting the right standards. The audit has so far indicated satisfactory to good levels of compliance with the Council's stated quality standards, and the providers themselves have really welcomed the opportunity to objectively measure their performance and participate in a really open and transparent conversation with the County Council about their service provision. The HDOM service specification gives us the tools to do this. Adults Health and Care have also facilitated an HDOM provider forum. We've shared market position statements and promoted best practice and networking amongst providers, and that's something that we will repeat in the future. In terms of consultation and inequalities, the Learning Disability Plan for Adults was reviewed in 2018. Service users and their carers reported that they continue to need meaningful day opportunities that provide positive outcomes. It's also apparent that day opportunity provision continues to fulfil a key respite outcome for carers. In response to the Learning Disability Plan, the County Council have stated that where formal day support is accessed, the County Council will ensure it is of a high quality and appropriate to people's needs and is focused on enablement, and HDOM provides the vehicle to do this. It's envisaged that this proposal will continue to have a positive impact for people with a disability or other assessed social care needs that live in Hampshire by providing assurance on the quality of service delivery based on the Council's service specification. Service users also benefit from the provision of outcome-focused service through a range of enablement activities, which support people to engage in a meaningful way with their local communities, becoming less dependent on funded services as their resilience, skills and abilities are developed. In terms of some other key issues that just need to be considered, we obviously have an ongoing duty under the Care Act to provide community-based care and support services, which these services contribute to. The provision of day opportunities to individual service users will continue to be reviewed as part of the Council's wider transformation to 2021 savings programme. Service users also retain the right to request that their personal budgets is provided to them in the form of a direct payment to meet their assessed outcomes. Transport remains an issue for the Council, so getting people to and from family homes, particularly to day service provision, does form an additional cost, which is not covered within the scope of this report. The County Council will continue to use the HDOM framework as a mechanism to engage with the market, and this will include a greater emphasis on outcome-based commissioning and supporting really good commissioner and provider relationships. In terms of COVID-19, the Council has provided significant financial support to the day services markets through the sort of lockdown period and going forward through recent Cabinet decision regarding financial support. This has ensured that these providers can remain financially sustainable during the significant disruption caused by the lockdown, which effectively caused their services to close due to social distancing requirements. We are working very, very closely with the day service providers during the recovery phase from COVID-19, These are quite complex discussions, and I think we're being very open that significant challenges possibly lay ahead in relation to the ongoing social distancing requirements and the impact, particularly on provider capacity in their buildings, and the sort of financial viability issues which go alongside that. Therefore, we envisage that significant redesign may be required in some circumstances. So the council will build on the success and innovation that we've seen from providers as well, in terms of some of their online offers and the outreach support which they've delivered sort of proactively over the lockdown period. So we're looking to retain some of the positive impacts that COVID-19 have driven people towards innovation. So in conclusion, the HDOM framework provides a service specification and a key quality indicators for the externally contracted day opportunities market, which were largely absent prior to its inception. Significant challenges lay ahead in response to COVID-19, but the HDOM specification remains fit for purpose. The 4-year extension will benefit the county council, and in short, we see that we need to continue to spend on these services as we go forward.
Thank you. Can I just ask, at the very beginning, you were talking about service users tend to stick with the same provider. I mean, if they go into one of these services, say in their 20s, does anyone actually explain to them that there are other things they could be doing? Because what suits them when they're in their 20s might not suit them when they're in their 30s, but their carers might think, well, that's where he goes or that's where she goes, and that's where they'll always go, as opposed to trying to broaden their horizons.
Yeah, it has been a challenge. We do have a number of people who, as you say, have entered services in their 20s and may still be there into their 30s, 40s, and even beyond. And that's something that we recognise that possibly doesn't present a great outcome for everyone. Some people it may be appropriate, but not for everyone. I think what we're seeing generally, Councillor Fairhurst, over the last kind of 5 years or so is a real shift in the council's emphasis around strengths-based approaches.
Yeah.
And really thinking about outcomes for people in a much broader and more inclusive sense. Certainly, we're very interested in more community-based activities for people, including volunteering, paid employment, and those kind of options to give people a much broader menu of services to choose from. There can be a tension, if I'm perfectly honest, between the needs of the service user and the needs of the carer, and occasionally we need to unpick that a little bit. So for some carers, the idea of somebody going to a service for a very in the longer term and all the security that brings can be quite attractive. But obviously we're really keen to make sure we really kind of focus on the needs of the individual within that discussion as well, and come up with the right options.
Yeah, absolutely. Thank you. Councillor Huxted, have you got any questions? Yes,
if I may, how many HDOM providers are there?
I think we're at 80.
80.
Yeah.
So you've only looked in detail at a quarter of them to date.
To date, yes.
I think mentioned. So is there a programme of looking at the rest of them through a given period?
We haven't got that scheduled currently. We are very much in the COVID recovery phase at the moment, Councillor Huxted, but certainly as we enter, as things settle down and we get back to some kind of normality, we will certainly be looking to reinstate that piece of work and to get round to all the providers over time.
So what were you doing in the first 4 years?
I think there was a period of bedding down. This was a new framework, and these providers previously had not really been used to this kind of approach. They've very much been left to their own devices to some extent, very spot purchased, very localized arrangements. So we did need to give them some time to adopt the right practices and to become compliant. I think on reflection, we probably should have done some of that work a bit earlier, and I think we'd accept that.
Okay, and the other thing is, it is quite a big pot of money, and you using the figures we've got, am I right in saying that we're spending about £7,700 per person per annum, and that yields about 200 half days? Is that the sort of level of activity that we are expecting?
I would possibly need to take that away to look at that in more detail, Councillor Huckstep, to give you a definitive response. But if I was put on the spot and asked, broadly speaking, that may sound about right. Yes. Yeah.
Okay, that's good. Well, clearly the service has got a track record, because otherwise we wouldn't be looking at the second 4-year period. So clearly, I'm in support of the recommendations. Thank you, Councillor Fairhurst.
Thank you. Can I just ask, I know we've been giving financial support to the providers. Is there any risk that some of them will not be coming back into use?
I think, if we're perfectly honest, it's such a broad range of providers. There possibly are providers out there who may be really challenged by the ongoing capacity issues. A lot of this will depend on their environment, I think, primarily. So the providers with the smaller environments, where they have less opportunity to promote social distancing, where they are limited in what they can do environmentally to make the environment safe, there may be a point where they just literally cannot bring enough people into the service to remain financially viable. We are currently having those discussions with the providers to see what support we can give. I did have a conversation with a provider yesterday who was facing that exact issue and had been proactive in sourcing additional buildings. So alongside their core building, they had been out and commissioned a couple of church halls to expand their capacity. So that may or may not be appropriate for every provider, but certainly the providers will need to think really carefully about kind of how they want to operate going forward. But there are options open to people if they're willing to be flexible, I think. Good.
And did all our providers maintain contact with their clients throughout the pandemic? Was there a lot of outreach going on?
Certainly, I think all providers have had some contact with their service users who would normally attend. It's been quite a broad range of responses, and some providers have been primarily focused on phone calls and very remote contact and welfare checks. Other providers have been doing things very much kind of out in the community, face to face. In terms of one-to-one support, supporting with things like shopping. It's been a broad range of responses. In our conversations with providers, obviously we've been trying to ensure that they do as much as they can to support people. Certainly, while we're providing financial support, we would expect to see a degree of value coming back to the county council in terms of providers continuing to deliver a service. So yes, on the whole, yes.
Good, thank you. Councillor Keast. Are you staying muted, or are you all right?
No, I'm unmuted. That's all right. Yes, thank you. I've got a couple of questions, please. The first one, obviously, partly been answered already, but it's around COVID-19. Are services totally back to normal yet, or is that still something which is ongoing? That's my first question.
No, we're very much in the discussion phase at the moment, Councillor Keast, around how providers are going to come back. It's a very individual discussion with each provider, because all those factors that we've spoken about earlier around their very unique environments, the service users that they would have normally attending. So it's a very bespoke discussion with each provider. The providers tend to be falling into two camps. So there are a group who are looking probably slightly forward in terms of September opening dates for an initial cohort, and then there are a group who are a bit more advanced and are looking early August. So we've got a number of providers who are looking at the 3rd of August potentially. So it's very dependent on their individual circumstances and kind of where they are in terms of staff being on furlough, the environmental modifications they can make, and the other big part of that, obviously, for us is around agreeing who's going to come. So reduce capacity, we're working really, really closely with the providers to make sure that we target the right people. So ordinarily, we're generally looking at people who live at home with family carers as being the priority cohort and to come back into services. What we are finding is that even where we think people may be priority, is that there's still quite lots of fear, and people are quite fearful still about coming into services. So even where we have capacity coming online, some people are choosing not to access. So there's a number of layers of complexity to that piece of work, but we're in the midst of it as we speak.
Thank you. Second question, is that all right, Chairman?
Sorry?
Second question, is that
Yes.
all right?
Mm-hmm.
Thank you. The daycare which is given is this mainly in daycare centres, or is a percentage of it in their own homes?
This paper, Councillor Keys, is focused really on day centres or locations. There's a wide variety, and some of them are very much day centres, which you would recognise. Some of the more vocational providers have things like horticultural sites, for instance, which look different. And then there are some very, very specialist services which are very fitted out with track hoisting and for people with more complex physical disabilities. So it's a very broad church in terms of the types of facilities.
Thank you.
Right, Dave, have you got any problems with the finance?
No, I'm content with the finances as presented in this report.
Thank you.
Thank
Right,
you.
Jason, thank you very much, and I'm happy to give to approval for this. And I just hope they all get back into action quite soon. I'm sure their carers will be delighted in most cases once they've lost their fear to get back there. So thank you very much. Thank you.
Do I log out the meeting now?
Yes, yes, probably. Oh, Samaya, could you perhaps stop the recording?
Yes, thank you, Councillor Fairhurst. We'll end the
Thank you. Yes, Jason, you can log out.
Okay, thanks all.